All right, hey, hello everybody. My name is Raj Sethi. I'm a licensed optometrist in the state of Florida. Today we're going to be doing a CO2 laser treatment around my eyelids. So what happens? Why does our eyelids get puffy? It has that sunk in type of feeling. So there's a couple of reasons for that. So one of them is, just like the rest of our face, collagen and elastin starts to degrade as you get older. The second thing is the orbital septum, which usually holds our orbital fat into place, also gets weaker. So in turn, the fat can start to protrude out. Three is our lymphatic drainage starts to degrade as we get older. Sometimes the fluid can also build up there and we get that puffy type feeling, especially in the mornings. There's two other reasons also, which include our orbital bone actually starts getting large as we get older. And the last thing is the muscles that are actually responsible for our blinking and opening our eyelids and closing our eyelids also gets weaker. Today we're just going to be doing a CO2 treatment to at least help with this tightness skin around that area.
Hey, hello everyone, my name is Alyssa. I'm a nurse practitioner here at Point St. Lucie Medical Wellness. Today we are going to do a CO2 treatment for my patient here. It is recommended that you get an exfoliation done beforehand, and it allows the laser to penetrate a little deeper. You could do something like hydrodermabrasion or dermaplaning. In his case, he did get exfoliation done right before this, which is why the pores are more visible in his presentation. So we're going to do his eyelids and then around his eyes. The procedure for this, we're going to be using 0.5 propofol, which is a topical anesthetic eye drop, and then we're going to put corneal shields in. Okay. Let's do this one. Okay, I'm now going to go ahead and place the corneal shields. Ready? Look down for me. Can you close your eyes? Okay. That one's in. Let's do the other one. I'm just applying some topical numbing cream right now because it can be a little sensitive. I already placed the corneal shields in, which is important because the numbing cream, if it gets in your eyes, can be pretty uncomfortable for the patient. Maybe about 5 to 10 minutes after the numbing cream has been placed, the patients will start to feel the effect of it. Okay, he is pretty much numbed up here, so we're going to go ahead and remove the numbing gel. I'm just using a normal wipe for this, and then I'm going to go over it with alcohol because you don't want any moisture on the skin. The laser will pick up the moisture as opposed to just going straight for the skin, which we don't want that to happen. Take an alcohol swab and clean the skin one more time. Alcohol has a very fast evaporation rate, so it'll dry it off too if there's any residual moisture. As I'm assessing his skin here, there are some actinic keratosis spots that we're going to go ahead and treat when we're done with this, just so that we can get them while we're at it. So the CO2 is set to deep fusion. I have it at a random setting on continuous mode in the size of a square. It is set to a size 8 because we're working in a small area, and it is set to 10 joules of energy. Lower lid and then around here by his crow's feet. The eyelids are a very sensitive area, so just keep that in mind. Move to the other side. Okay. So those are the eyelids. We're going to move on to these AK spots here. Okay, so as I mentioned before, he has a lot of actinic keratosis on his skin, which are caused by UV light. When you live in Florida, for example, you're exposed to a lot of sun. Even with sunscreen, it's very, very common that you get these. The issue with them is that they are precancerous, and they're often a precursor to things like squamous cell carcinoma, which we do not want, obviously, to progress, so we want to get those under control. Some treatments do include the CO2. Also, you can get them frozen off with cryotherapy or just plainly excised. Any of those will treat them. These spots here are the AK that I was talking about. They're very small and it doesn't really seem like much more than a pimple. However, this is what the typical presentation looks like, and it is important to get these off. For the AK, we're going to be using Fusion Deep on a stamp mode, so not continuous. And we're going to do it random and then a size square of 12.6 with a distance of 1.2. Okay. It's got about like 6 or 7 of these lesions. Okay. Alright, here we go. Alright, that's one. Got about 2 or 3 of them here, so I'm going to try and hit them, in a cluster as opposed to individually. And I believe that is everybody. There's one up here, alive. Okay. And that is all of them. Part of the aftercare for this procedure, we're going to be using the Elastin Restorative Skin Nectar, which is a regenerative ointment. It helps stimulate collagen and elastin. It can also be used for 2 weeks prior to CO2 treatment as a prophylactic preparation for your skin. So you can do that as well. And we're just going to use a very, very little amount because a little goes a long way. We're going to put it around all the areas that we treated, including the eyes. You can expect to see this kind of turn almost like a coffee ground color, and then it will flake up and fall off. And you're gonna wanna avoid the sun as much as you can. Hat, sunscreen, all very important all the time, obviously, but especially after this. If there is any stinging or anything like that, you can take a normal 18-ounce water bottle and take a cap full of white vinegar, put that in the water bottle, shake it up, and then put that all over your face anytime that it's burning, and it takes the sting away. The CO2 typically takes anywhere from 4 to 6 weeks to heal up, and then after that has fully healed, patients can come back and do a secondary treatment if they need to, if for whatever reason the spots are not fully gone, or if they have more areas that they'd like to treat. We usually typically recommend about 4 to 6 weeks in between each session. Thank you guys so much for watching this video. Please follow along for more in the future.